we'll look at pec major, pec minor here. So one of the things I do for pec major is put it in a shortened position. I'll find that through the muscle right there. So you need to hold yourself. You can go in. So that's what I tell female patients. They're responsible for holding everything. They want to. So I'm going to find the muscle belly right there. I'm actually going to put it in short position, push down into the muscle, hold that, and do a little stretch. You got to find the angle to get the most stretch right there. It's a lot more tightness. I'll just hold this for a little while, 30 seconds, a minute, however long good commercials last or something like that. A lot of stretching there. So really, you can actually do some active stretching for a while. Follow it up with some isometrics. A lot of times you just track relax out of this. So there's a lot of different ways to do soft tissue, as you learned last summer. You can actually go and do some cross friction massage there. What's that? Tendon head. 2. Pec minor. So see very tight. Pretty tight right there. So this one, so you know corcoid, don't get on the corcoid, just slightly off of it. Right on those ribs. Come in here and just do a little stretch there. Hold that. If you don't like fingers, trigger point ball works really well. I'll push down into it. The only thing I don't like about the trigger point is I don't get a feel for the tension. It's a really good way to work on this. You can also have them at home. Use the trigger point ball, put it right there, and lean into the wall. Really good home program stretch, pretty easy to do. So as long as they know what this pressure feels like, you get an idea of what's going on, they can do this at home.
What's your pressure like when you have your hand there?
Pretty firm.
And are you going just straight down to the table or
straight down to the table and slightly stretch, slight stretch.
I just use this at home.
So you just have them.
Do you have them try to retract?
Push right there. No, I push right into it. For now. Then after we release it, now we work on stretching that motion. Get a release, that muscle relax and really stretch it. So you have to follow this up with stretching, range of motion. Like any other technique, you're gonna try to make something more flexible. You gotta create the motion, then you gotta use it, or you will lose it. So it's like everything else. If you don't follow up, you just repeat the same thing every day. So, and you can follow out, like they follow out with your shoulder stretches, pec minor, work a new motion. get on the border of the lat because it's pretty thin muscle. From cadavers wide, very kind of thin. It's a little hard to get underneath there. They're really tight to get to that border of the lat. So you can also just do some try to relax out of this. To your side. This one that's really effective here is to do a posterior cuff. So you're going to stabilize that scapula. Let's see what she's got. She gets to right there. So you come in here, posterior cuff. You can do your same pressure, short position, burn pressure. Stretch the other way, you can do it. Burn pressure, and as long as you know that scapula is not moving, you start to see the scapula move, then you know you're no longer stretching posterior cuff. Yep, reverse. The other way you can come in is do some cross friction. This works real good. Right behind that humeral head. Muscles right there. Just a little bit of motion, stabilize. So you can make a lot of progress right there. All posterior cuffs. Let's flip over to the other side. Even you out. This 15 seconds worth of work. Shows you lots. In here, there's your head. Pressure in, slightly down. Let's just see what we got first. Not bad there. Down, stretch. Or just some cross friction there.
Cross friction over the head.
Over the right behind the humeral head. So you're right over those posterior cuff muscles. So you're getting little teres, maybe probably not too much infraspinatus. That's much progress. You can use a little lubricant if you need to. They get real irritation, a little irritated on the skin. So a lot of times they just free up. There's a lot of products in here. Back on your back. What else?
I usually address the capsule, but I definitely address the soft tissues for that reason. I sometimes argue in my head, is it really that we have posterior capsular tightening, or is it the soft tissue extracapsular that's guarding? Because we're in this sustained forward position, the muscles move abnormal. When you do just a little bit of soft tissue work on those muscles, you get a good mobility improvement.
Yep. All right, so subscap. Start over here. All right, so how do you get the subscapularis? On the front of the scapula. So you gotta dig in the armpit a little bit. Armpit below it. And the front of the lat. They're tender, you know you're on the right spot. Yeah. Go there. Better segmented external rotation. People have external rotation limitation. They need to go to subscap first. Check it out.
What?
Going to check the subscapularis muscle first.
What do you do if you're lefty? Are you like rotating down as
holding. I'm just got. This is a hard one to kind of get in there and do any type of massage. It's so tender. Typically, I just hold pressure there. It's one you almost have to use your fingers for. Fingers or thumb. You're gonna get about that much access to this subscapularis muscle. But all that scapula is gonna come, flat in that lateral, so you don't get a lot of access to it. So you almost have to kind of reach in there and dig and push down in there. Show that on this side. So there's her scapulas right there. Just gonna come in. There we go. So my fingers are just going to dig kind of down in there. Just trying to rotate, stretch. I lost it. Didn't like it. Didn't like that pressure. It hurts. If you're in there and they're not in discomfort, you're not in the right spot. This is a muscle that's very tender. You just have to dig in there. You're probably not going to get too many chances at it.
So can you feel a release, or will you just see more?
You'll see more motion. Yeah, you're not going to, you may feel it relax a little bit if they're really, really tight. But in most of you, you're probably not going to feel a release. Most of them, unless somebody's really limited in external rotation. All right, and like I say, we can do some supine and horizontal abduction also. Block the scapula. Just do some pushing in, contract, relax, pushing in. Just holding that scapula. Just working on horizontal abduction. Really good way of stretching. You're going to just everything. We don't know what we're getting. There's nothing specific. We're probably getting a little bit of infraspinatus, teres, maybe a little supraspinatus type stuff. So just sit up. Once not on here, to get this supraspinatus, you want to do some cross friction on it. Take the arm, and this one's a hard one to get. Most, you've got any limitation in shoulder stiffness, it's really hard one to get. You have to come in and pull this arm into the lift off position. And just below the chromium there, you can actually palpate a little space in there between that humeral head, and that's where you're going to get the supraspinatus at. Do a little bit of cross friction there. Supraspinatus, it's not on your list. This is your bonus. There's cross friction massage. Yeah, like I said, you do cross friction massage on most all of these if you want. This is one you almost have to do pure cross friction massage just because there's so little access to this tendon. Okay, so chromium's right there. I'm just gonna fall off a bit. So there's a little valley right there. Humeral head's right there. Chromium's right there, and just in that little valley you can get into that supraspinatus. So you have to be in this fully internally rotated. So not everybody you'll be able to get that with. Most of your shoulder patients, they're really limited. You might get to the buttock here. Probably not enough to get to that supraspinatus.
Can I add how I usually do it?
Yeah, that's why there's 50 different soft tissue courses out there.
I just have them in different positions, so I just have them on their back, and it's usually when I'm doing their range of motion. So scoot this way, and I have them in as much internal rotation. Just relax your arm. And then I find the acromion, I come off the acromion, and use, depending on the person and depending on how much rotation they have, I'm right off the acromion still. I'm usually my first 2 or 3 fingers, and I'm palpating for where they're the most tender. And if they have rotator cuff tendon involvement, usually there's a specific spot where they're very tender. That's really my best gauge. I try to guesstimate where the tendon is, but I really chase the tenderness. And then I just stay there, and then I do my cross friction in this position for 2 to 3 minutes, and I wait for them to tell me that the pressure is less tender than it was when we first started. How's it feel to you? Is it a little bit tender?
Yep.
So if you can't get them in this position, or if it's awkward, you can't really use your body weight when they're sitting. But once you get them in supine, it's a little bit less work, I think. And I only do it for, I can't even say I do 5 minutes, probably 3 minutes typically, and it's usually when they say it doesn't hurt much. And then I do a little bit of mobility and move on.
Syriax says 10 minutes on friction massage.
That's a lot.
I'm not quite the man Syriax was. I cannot tolerate it for, as a patient or as a therapist, my fingers don't last that long. So there's other ways, there's other options. Shoulder dry needling works really well. I'll show you that in the spring. There's a lot of different myofascial release. There's cross friction. There's contract relax. There's what they call active release technique that the chiros have kind of coined. It's really a brand of soft tissue release that came out of England 30, 40 years ago. There's I don't know. There's a lot of different soft tissue. There's some people say Graston, A-stem, all these other techniques, these commercial techniques. So a lot of different options for soft tissue. That's what I'm saying. Cannot teach you all of them just because there's just too many out there. You can spend